she's traveling also. You have also to plant some trees coming here. She's a nephrologist, and she will talk about frostbites. And she's also a member of the medical commission of the UIAA, and you will hear her again in the women's session.
Yeah, thank you, Urs. Yes, my name is Kastė. My second name is Pipirienė. It is Pimiente. Yes, very nice surname actually. And today I will present few lectures. The first one is about the frostbite. But first of all, let me see if it is common, if the frostbite is common here in South America. Please raise your hand if someone had a feeling of tingling, numbness, pale skin, or sensation loss during the travel. Yeah, oh, few. Okay, so that's why we are talking about this today. Okay, so then my next question, is there anyone who had blisters after the rewarming procedure? Did someone experience this? Okay, 1, 2, 3, 4, oh, okay, not so. I didn't expect so, but okay. So my last question, and I hope there will be no hands. If there is anyone who had an amputation of the finger, toes. Oh, yes. So now let's raise your hands, your healthy hands, everyone. Yeah. And let's try to keep those hands healthy for next of our life, okay? So today, the signs about the incidence of the frostbites. Actually, the incidence is the variety is very big, and it's because of a different population studied, different methodologies, and even definitions of the frostbites. They are different. So I could say the science doesn't know how often frostbites happen in mountaineering. So let's go further. Simply, frostbite is a freezing cold injury. What's happening? First of all, skin is exposed to the extreme cold. Extreme cold, it's a -°C. It's a freezing temperature. Then, in the skin, the vasoconstriction happens. The vessels constrict, and this restricts the blood flow to the skin and also other tissues. And also, it inflates the heat delivery to the fingers, toes, nose, and somewhere else. This causes the ice crystals, which forms in intracellular fluids, and sometimes even in the cells, and the direct damage of the tissue happens. But this is the beginning of the damage. The main damage happens right after we starting the rewarming of the frozen part. So what happened? The other process kicks in, and like ischemia, inflammation, thrombosis of the small vessels, and also the destruction of the microcirculation. Is it dangerous? Yes. First of all, what's happening is there's a loss of feeling and the function because the nerves freezes. So there's no way to feel, no way to muscle to use. The damaged tissue is more susceptible for the infection and also can go to the sepsis. It's also life-threatening condition. In the severe cases, even gangrene can happen, which can cause the amputation of the limbs, the fingers, the toes. And of course, all this freezing injury is a very painful thing. Even the mild frostbite is painful, but those severe things, they really need a good painkillers to survive. And there is one more thing, there is a chronic pain after the frostbite. It's also because of the nerve damage. I also wanted to mention a few more risks. First of all is hypothermia risk. you already heard the lecture before. So this is a life-threatening condition, and it also always goes together. It's not always, but it often goes together with the frostbite, so you have to keep it in mind. With a frostbitten fingers, toes, or other places, so you feel pain, so that might compromise the judgment and performance, so it becomes more difficult to move, more difficult to take crucial decisions, and maybe evacuate from the emergency situations. Also, it has a psychological impact, because those people who experience those frostbites, they might be afraid of repeating this traumatic event later on. So that's quite not comfortable thing, I guess. And of course, increased susceptibility to the future frostbites is also quite common. So today, I will talk more about the risk factors and the prevention, about how to early recognize those symptoms of the frostbite, and the self-help and the first aid in the field. So I hope it will be useful for you. For this lecture, I used the guidelines, the updated guidelines from the Wilderness Medical Society, also from the state of Alaska, and the recommendations from the ICAR. And first of all, I will talk about the risk factors. Already Benoit mentioned those risk factors, which we can divide into environmental and individual. And those environmental risk factors, of course, the cold temperature, usually below 0. But we also have to keep in mind the wind. So we know about the wind chill already, the moisture, the wet skin, the wet clothes. They lose the heat much faster. And also the altitude. With altitude, we have a hypoxia, and with a hypoxia, the microcirculation is reduced, so the risk of the frostbite is higher. The individual factors, they are very different, and these factors we can actually change and prepare for this. Of course, we talk about the clothing and gear. Yes, we talked already about the fatigue and the dehydration. So when you are fatigued and when you have less liquids in your body, it's difficult to regulate the heat production. And some certain medical conditions like diabetes, peripheral artery disease. Here in the picture you can see the Raynaud syndrome. And of course, immobility, especially after trauma, may also be a quite big risk factors for the frostbite. Smoking and alcohol use, this I wanted to mention. Well, the nicotine, while smoking we get the nicotine, and it constructs the blood vessels. So the microcirculation and the heat production, heat delivery to the skin is lower. It's a quite big risk factor for the frostbite. And alcohol use, yes, alcohol actually dilates the blood vessels, but that can worsen the hypothermia. And with the hypothermia, the frostbite might happen again. So that's why we shouldn't treat ourselves with the alcohol in the field. And we already mentioned the previous frostbite injury. So these are the individual risk factors. Knowing these factors, it's easier to prevent. And later on, you will see that prevention is much, much better than a cure. The prevention. Well, first of all, we will think about clothing and gear. And already Benyu mentioned the layering system. Of course, we have to choose the warm materials for our clothes, like wool, sometimes synthetic fabrics. Down is very good for insulation, but when it is wet, it loses its function, so we should keep it in mind in the wet weather conditions. We should protect extremities, starting with the feet, good footwear, insulated boots, good gloves. Sometimes maybe mittens are much better than the gloves. And also don't forget head to cover the head, the ears, which might get frostbitten too, also nose and other parts, of course. For the prevention, it's also worth to check the weather before the travel, to know if there is going to rain or to snow, or the wind changes, or if it is going to be sunny like today. And with the weather changes, one thing I wanted to mention a little right after the climate talk, that with this climate changes, the weather changes much faster nowadays. So to the prognosis, they are getting it's more difficult to prognose the weather lately, so we should keep in mind. Of course, we should understand our limits. Don't go after your partner if he's much stronger. Don't push yourself beyond your limits. That's quite important, not to get fatigued. And it's important to plan the route, so you know where to hide from the rain, or where to hide from the strong winds, or when you are tired, just where to sit in warm place and to drink Coca-Cola maybe. Yes. And one more thing, it's a good idea to practice good hygiene. The dry skin is much better than wet, sweaty skin. During the travel, again, stay dry. If you got wet, change those wet clothes as soon as possible, as when it is really comfortable. Of course, take spare gloves, take spare socks with you, so you can travel quite easy. Move regularly, so you can produce heat by muscle constructions. Also eat and drink, so you have fuel, and also hydrate the quite liquids for the microcirculation. Yes, sometimes look at the not only at the sun but also at the sky, so you know when the bad weather is coming, when the winds are coming, when they are getting stronger and bringing us the rain or snow. Of course, if it's getting cold, try to find a shelter from this, and regularly check your fingers, toes, nose, ears. Of course, try to check also your partner's ears, nose, and also ask them if they don't have any cold feelings, any different feelings in the fingers or toes. And lastly, seek medical attention immediately if you suspect the frostbite. So this was the prevention measures, and let's go now to the early recognition, which is really important for the prevention of a frostbite. And the first thing to think is the sensation. Of course, when your fingers are in gloves, when you have a boots on it, you can't see the skin at that moment. Of course, you can't see your nose or cheeks or ears too, so you should take attention to the sensation. At what it happens in the first, you can feel, of course, the whole sensation, and then the sensation is changing in some kind. It might be pain, might be tingling, might be prickling, burning, itching, something differently than it was before. The late sign, when there's a numbness, when the feelings and the pain disappears, that's a late sign. That's already late. The early skin signs, the skin may appear pale, red, patchy, often on fingers, toes, nose, cheeks. Might be swollen or even waxy. And that's a good time to recognize the frost nip. That's not freezing cold injury, actually, of the exposed skin, when superficial ice crystals forms on the skin surface, and vasoconstriction, which causes the numbness and the pain of that part of the skin. It resolves quickly if rewarmed, but it can proceed to a frostbite. So that's time to move, to act. Well, the progression, if you see that your skin is getting white, gray, bluish, sometimes blisters may appear, or your skin feels hard, numb, sometimes movements can be clumsy, that's already late signs of the frostbite. Is it the time for the first help? Well, actually, we shouldn't wait for these signs. We should help ourselves much earlier. So now what we can do for ourselves? First of all, of course, we should hide from the environmental factors, from the wind, snow, rain, from the cold. It's clever to change the wet clothes to the warm, dry clothes. And drink warm liquids, again, yes, with a sugar, it's a good idea. Remove jewelry, it's quite important because the frostbitten area might become swollen later, and you won't be able to remove those rings later on, and it also constricts the blood flow to this area. Also is a risk factor for the frostbite. And you may try to warm up this limb, for example, in the armpits, in your own or your companion, and do it for 10 minutes. Ibuprofen tablet might help. It will reduce the pain and also inflammation later on. And also, if it is at a high altitude, and it is possible, if it is available, you can use the oxygen. It will help. What you shouldn't do, don't use the snow or ice to warm up the area, and also do not direct heat, because it can damage even more the susceptible tissue, damaged tissue. So, and if sensitivity does not return after this 10 minutes of the warm-up, then you will need a more professional medical help. So go down, stop your track, and try to find the medic or someone else who can help you. And so now let's see what can we do in the field, in the base camp, when the patient comes with the frostbitten fingers. And first things what we should do is we should check. We should check if there's any symptoms of hypothermia, and we should assess it, treat it first. We should check for the extent and severity of frostbite, and also from other injuries, because those damaged parts, frostbitten parts, they are insensitive, so patient just can't say if it is only the finger or if it's the finger of the right hand or left hand. Sometimes even those may be frostbitten too. And again, if it is not done before, remove those clothes, rings, which restrict the blood flow. Then you probably would like to warm up it as quickly as possible. Yes, but there are some rules, some recommendations when you shouldn't do this. So first of all, don't waste your time for this unpleasant procedure. If you can evacuate the patient in 1 or 2 hours, where they can get the professional medical help. Also, if it's not possible to protect the frozen limb from refreezing, because refreezing is much worse than late rewarming. And lastly, keep in mind that the patient, after the rewarming, won't be able to use those damaged limbs. He won't be able to climb with his hands. He won't be able to walk with his rewarmed feet. So if you need the patient to walk by himself from the mountain, then it's clever to just postpone this rewarming, but not doing this in the base camp. Anyway, in all these situations, don't try to protect from the rewarming. Let it spontaneously rewarm. Okay, so the procedure of the rewarming, you will need a large enough container for your hands and feet so that the lymph won't touch the container edges during this procedure, and you will need hot water enough. It's clever to have the water thermometer in base camp, so you can make the water as hot as 37 to 39 degrees. In some other literature, it's up to 42, I think, degrees Celsius. And also you should have additional water, so you can add the hot water, because when you put the cold limb into the water, it will cool down. You may put some antiseptic solution. It's not necessary, but if you have, it might help. Also, you can use this procedure for at least 15 to 30 minutes or until you see that the skin turns red, soft and pliable to touch. So then it's time to discontinue. And when you take those limbs up from the water, don't use the towels, don't wipe them. Again, this will increase the damage. Allow it to dry in a dry, warm air. And for ear, nose, and the other body parts, which you can't put in the container, you can use the gloves, which you can damp into hot water again. Put towels so you protect from losing heat, and also redamping those gloves quite frequently so you keep them warm. The minutes the same, then don't wipe with a towel again. After the warming, the size and degree of the damage become apparent. Then you can see that is there any superficial damage or is there a deep damage. If you see the large blisters, light blisters, a large swelling, that's quite a good sign. With a good treatment, it may have a good prognosis. But if you see this like a small swelling, black, bluish black color of the skin, small blisters, hemorrhagic, then it's a bad sign. And the prognosis also depends on the size of the damage, and the probability of amputation increases if not only the fingertips, but also the palm, the foot is damaged. What to do after the warming? Well, you have to protect. The light blisters might be sterilely open for easier dressing and transportation. The small dark hemorrhagic blisters should be kept, shouldn't be open, and they are protected from the damage. There you might use the aloe vera cream or gel, which protects from inflammation afterwards, and also protect from you use the bandage, soft, non-pressing, sterile, and non-stick bandage. That's the best. Place the gauze between the fingers so they don't touch and don't do more damage. What else? Continue on ibuprofen, 400 milligrams twice daily. For the analgesics, I guess you may need even more stronger analgesics for the pain control. So sometimes, not maybe in the high altitudes, but a bit lower, you may need opioids. You will need the hydration. So probably we will talk about oral fluids. If it is possible, you can use intravenous, but you already talked that it's not available in the base camps. There is a low molecular weight dextran which you can use in the field also, but again, it's not available everywhere. For example, in USA, it's not available. And again, the supplemental oxygen also may help to reduce the damage later on. Here is the picture of what you might need. So aloe vera. I don't know how it is in Spanish, but I guess you understood me this time, yeah? So hot tea, sweet tea, it's a good idea. If it's possible, some intravenous fluids, oxygen, ibuprofen, and a bandage, a lot of soft bandages. And of course, the evacuation is the first thing what you have to think of. And for the evacuation, there's a few rules. First of all, you should protect this rewarmed area from refreezing and other damage. You might keep the limb kept elevated above the level of the heart. And also, recently rewarmed limb should not be used for walking, climbing, or other maneuvers. And for the evacuation, if it is possible, try to organize the evacuation to the specialist center for angiography and iloprost infusion for thrombolytic therapy and other therapy which reduces the damage after the frostbite. In 24 hours is the best, but well, it depends on the areas how fast you can evacuate the patients. Okay, so that's all from me. I didn't hear no.